large part of your specialty is a surgical, urology is a surgical specialty, correct?
It is indeed.
So let's talk a little bit about some of the initial surgical or some of the possible surgical corrections that can happen for incontinence, or you can use surgical techniques, if you will.
Okay, we certainly can do that, but with primary care, I think before you do start the anticholinergics, it's really important to make sure the patient isn't in retention, and that's a very simple thing. You can either do an ultrasound of the bladder to confirm that, or you can catheterize the patient in the office, and also to make sure the patient does not have a urinary tract infection. Once you've tried the medication and they've failed, then that's for us. But in terms of the treatment, it depends again on the problem. If the problem is stress urinary incontinence, and I've told you that you basically need to augment the support or the pelvic floor, you need to basically really know what's going on in the bladder. Is the bladder prolapse? Is this something that we're seeing with cystocele, rectocele, interocele?
And those things are, so that we can elaborate for our audience, cystocele and rectocele. That is when the bladder is starting to come out of the vagina, correct? When the vagina prolapses, and you may have some basically tissue coming out of the vagina, which would either, in the case of a cystocele, it's a bladder coming out. Rectocele is when the rectum is coming out of the vagina, correct?
Correct.
Even compounding the challenge, the emotional challenge, and the difficulty that this can be for a patient to live with. So then at that point, then definitely surgery is something that we have to
something that we need to have as an option, but also patients need to be aware that it's not the only option, particularly for a cystocele. There are some things such as pessaries can be used to support the bladder and to put things back into perspective. Why would you want to know about that? Because say you're 85 years old, I'm not sure you want to consider something as aggressive as surgery, but you can be an 85-year-old active person, so that doesn't mean that surgery is out of the question for you.